Hello, and welcome to the Pulse of Manatee, brought to you exclusively on Manatee Educational Television. I'm your host, Dr. Shrini Iyengar, a cardiologist at the Braden Cardiology Center. February is a special time around my office. With Valentine's Day and many of those celebrating we love, it's also the perfect time to check out your heart. February is known as Heart Disease Awareness Month, and since heart disease is the leading cause of death in the United States, this topic really deserves a lot of attention. Today we have an excellent panel to help educate all of us on the dangers of heart disease and stay on track for a better, healthier heart. Let me introduce our guest today. To my left, we have Dr. Jennifer Bala, a nephrologist from Manatee Kidney Consultants. We also have registered nurse Paula Jefferson joining us today. She's the director of the Heart and Vascular Center at Manatee Memorial Hospital. Thank you for being here, guys. Let's get started.
Thank you.
So ladies, this is Heart Awareness Month. So Paula, let's just turn to you real quick here. You're wearing red. Now, what's the significance of that?
That's to bring attention to women in heart disease and the awareness that women do have different symptoms than men in heart disease. And it's a little vague, and I think, Dr. Iyengar, if you want to explain some of those symptoms or just say what those symptoms are for women and how they differ from men.
Well, I think that what we see in our office a lot of times, and for patients at home watching, this is really important because women oftentimes may not have that classic crushing of the chest or the elephant on the chest symptoms, and they may have something like back pain or neck pain or abdominal discomfort, which are really different than the classic examples that we've learned in medical school and training of the elephant sitting on the chest, radiating to the left shoulder, left arm. So we like to tell women not to minimize their symptoms. That's really important. Now, Jen, in your office, when you're seeing patients, especially from a kidney standpoint, what do women typically appear of when their blood pressure or they have other issues related to the kidneys appear compared to men?
Well, they're pretty much the same, essentially. But the thing is that women have to remember that they will, as far as like heart disease goes, they are just as susceptible to it as men are. My specialty is concentrating on the kidneys, and hypertension as well as diabetes is very near and dear to my heart. So we have the number one thing is always educating both our men and women patients.
And that's, I think, is critical, is education, because obviously being a kidney specialist, you work a lot with dialysis patients, but we want to catch these patients way before that.
Absolutely.
That's the main concern here. And we also know that heart disease, vascular disease, kidney disease, all interrelated. Everything is working together in the body. Now, Paula, when you say education, what would you think an educated patient should be well aware of?
They should know their symptoms. They need to know when they're having a heart attack. They need to know that they need to call 911 if they're think they're having a heart attack. If they think their friend's having a heart attack, they need to call 911. They do not need to be minimizing those symptoms and trying to drive them to the hospital. We need to get the experts there when they need them. So those are all important things, and I think we do need to educate. Even we need to start in elementary school and educate the children on healthy diets, healthy living, get outside and exercise. All those things are important when it comes to heart disease and wellness.
And again, women just tend to take on a lot more familial tasks, and they worry about other things. They say, well, I have to pick up the kids, I have to worry about cooking dinner. We want to emphasize to women at home right now that heart disease can affect them equally as much as men, and that heart disease is the leading killer of women in this country over types of cancer. So the fact is that people at home or patients at home that are watching this right now, it's very important to emphasize that if you have these symptoms, like this abdominal discomfort that's not going away, the back pain, the neck pain, these are different types of symptoms, or lethargy. These are issues that you really need to talk to your primary care doctor about. If it's getting worse, then definitely what Paula said, calling 911 is the most important point to take home. So really, don't just assume because your husband or your loved one that's a male has these symptoms that if you don't have it, that you may not be having heart symptoms. Very important to emphasize that women and men can both have these types of issues and really need to get taken care of. So Paula, let's go back to education here a little bit. Now we're talking about heart disease this month. But as Jen just mentioned, diabetes, big thing. So what would we talk about?
Big risk factors.
It's a huge risk factor.
And it happens in both men and women, and it does do it. People don't always have symptoms with diabetes, and that blood sugar does affect their vessels. And when I worked in a cath lab for many years, and when you looked at a patient that had diabetic vessels, they were very scrawny and skinny, unlike the other vessels of a normal heart. So it does really play a toll on your heart vessels. So that's why you need to let people know that they need to control their blood sugars. They need to monitor it. They need to have a healthy diet. We need to get a healthy diet in these children when they're young, and it's moderation. And I think that we really need to educate kids in school and middle age, you know what I'm saying, so that they know what they can eat and what they can't eat.
Well, Jen, from a renal perspective or a kidney perspective, how does diabetes play a part in the evolution of kidney disease?
I think one of the things we have to always remember is that everyone concentrates on the heart, everyone concentrates on blood pressure and diabetes. We, as far as like what we're born with, the arteries, the blood vessels are the same throughout the body. And whatever you're trying to concentrate on with your heart, with your blood pressure, it's affecting the kidneys as well. So making sure that everything is monitored early, like Paula was talking about, starting in childhood with diet, with exercise, that is really key as far as like trying to lead a healthier life.
And I think that people don't realize how interrelated the kidneys and the heart are, because I think a lot of people say, well, I have kidney damage, but why is that my heart? Why should I be worried? Or vice versa.
You may see kidney damage before you see heart damage. That's the biggest thing. You know, whenever we have patients who are first diagnosed with diabetes, when they come into our office, one of the things we're looking for is if there's any protein in the urine. It's very microscopic, is the very first sign that there's any vessel damage going on in the body, and that's the time to catch things, because that's actually reversible. That'll tell you if you've got any other vessel damage going on, particularly the heart, but other things like the brain, other small vessels as well.
And for patients at home as well watching this, we're talking about arteries that feed the kidneys, but not just feeding the heart, but also, as Jen just mentioned, arteries that are feeding the brain called the carotid arteries. So when individuals have some disease in a vascular bed in the body, whether it be the kidney arteries, the heart arteries, or the vascular arteries of the neck, it's important that a systemic view is taken, that we don't just look at one particular organ. So it's important that we're emphasizing not just the heart, but the kidneys, and also arteries that feed the brain are important as well, obviously. So the other thing, Jen, is hypertension. That's probably the main thing that you're probably seeing in your office, I would assume, that causes patients to come in with kidney damage. What is hypertension? How do you define that?
Hypertension is, obviously, it means elevated blood pressure, but everyone's got access to checking what their blood pressures are doing. When you see a blood pressure that's over 140, for example, that should get people thinking that this is not quite normal. That's the top number we're talking about. The bottom number, for example, over 85, and every year it looks like it's getting even tighter and tighter as far as like what we're defining as hypertension. It's right up there with diabetes. It's like number 1 and 2 reasons why people end up on dialysis, or even 1 and 2 reasons why they end up with cardiovascular disease.
And that's important too, because I've seen hundreds of patients in my office that will say to me, Doc, my blood pressure is elevated because you're a white coat. I just get anxiety, I get anxious. So what I tell every patient, check your blood pressure regularly during the week and write it down, because 136/90 is not normal.
Right, absolutely.
And that's what we have to tell people. Feel good at it, but they think that it's better than my neighbors who's 180/100 all the time. Don't compare the people that are around you because they're elevated. Make sure your blood pressure is controlled.
And
Paul?
there always is those blood pressures at Publix, or when you go to the grocery store. There's screenings at different malls when you go there. You should have your blood pressure checked, and you should really follow that and monitor it, because that is also known as a silent killer. People don't know they have high blood pressure. And really, if they have high blood pressure, they either need to be on medication, or they need to monitor it. They need to go to their doctor. They need to be able to talk to their doctor and tell their doctor their symptoms, or what their blood pressure has been.
But I think we can all agree, blood pressure doesn't have that sexy appeal like coronary disease. When someone says, I had a heart attack, they will do whatever you say after the heart attack. They will quit smoking, they will work out. But when you tell them you have high blood pressure, they tend not to really concern themselves too much with it. They say, well, I'm stressed. I have issues at home, or I just can't eat the right foods every day. People need to understand that hypertension is a prerequisite almost to a lot of these other conditions that come down the road. Now, Jen, how do you convince patients that come to your office to say, listen, so my blood pressure is elevated, I don't feel that bad?
I love that silent killer word you were using, actually. I use it all the time, because people don't necessarily feel that the blood pressure is going up, and we're trying to prevent things such as heart attack, such as kidney failure or stroke. That's what we call end organ damage. The damage has already been done. A lot of times it's not reversible. So I like to stress to my patients, this is a potential silent killer. This is the time that we can actually get things under control, be it with medication, or the biggest thing is lifestyle modification. modification. Not the easiest thing to do, but this is the time to actually change
let's talk
things.
about that lifestyle modification, because every patient that I've seen with hypertension or high blood pressure tells me, is there something I can eat differently or do differently before you give me a prescription? I don't want to be on a prescription. So what would you suggest to these patients that say that? Is it the salt reducing in the diet? Is that the first thing you do normally?
Salt reduction in the diet definitely helps. We eat a ton of salt in everything we do. If we go out to eat, forget it. You're going to be well over what we're requiring. And if you can try to reduce that, we're looking at maybe 2,000 milligrams of salt a day. And that's not that bad, actually. It sounds like it's pretty low compared to what we're doing. That's one of the big ones. I think increasing your exercise activity, and I'm not expecting people to start hitting the gym and start running a mile or two a day, just trying to do something a little bit more active than what they had been doing, actually looking at what are you eating, is there anything in particular you can actually change? Because people do recognize what is good for them, what is bad for them. It's just a matter of trying to get them to maybe try to make that lifestyle
like
change.
a sense of responsibility, right, Paula, to get them to understand that they have to take it upon themselves to say, hey, look at the ingredients in food.
Yes, and also exercise, like you said, is a number one thing that people, that needs to be a regular part of their life, just like brushing their teeth. And it doesn't have to be, they don't have to go to the gym, they don't have to pump iron, even walking, parking their car farther away, but every day they need to incorporate some exercise into their lifestyle, because that's very important. It just works as well as your diet in reducing high blood pressure and cholesterol levels in your body. So
yeah, the American Heart Association states that basically 5 days, 5 times a week, 30 minutes a day of exercise, aerobic fit exercise, is what is required for most people, because we do have an obesity problem in this country. And I think that, Paul, your initial point, when do we start with these types of individuals to prevent heart disease in the 5th and 6th decade of life, even in the 3rd and 4th decade of life? Look at the kids that we have today that are coming out, they're growing up. They're 12-year-old kids that have diabetes. Mm-hmm. I mean, what are the ways to avoid this? What do you guys suggest? What do you think would be the best route of preventing that?
Well, limiting the time they get to sit in front of their games, limiting the time that they get to watch TV. They need to incorporate some type of exercise or some type of outdoor playing or some type of physical activity in their lifestyle. And that should be a family affair if it's possible. You know, they all can do something together, but walking the dog, little things like that gets them outside, off the couch, off the chair, and in some fresh air.
Jen, what do you think? Is there some way, what's the age groups that you've seen in your practice? Do you see patients with hypertension at a younger age coming in now?
Absolutely. We're seeing them earlier and earlier, which is actually not a bad thing. You know, that means they have been referred to us for something to be done. But I agree that it has to start younger. We're getting these children that are getting more either complacent at home, or they've got the indoor activities. But you mentioned all you need is this amount of activity per day, and it doesn't have to be in one setting. For kids, I mean, you should be able to get outside and enjoy and play.
Exactly, and that's something that I think is with the issues in schooling, they're taking away recess time, they're taking away gym classes. I mean, I think it's pretty important to know that you have to get out there and do something, because these vending machines that supply these power energy drinks full of sugar, terrible things that I think the kids will develop in the long run. Now, there's one major risk factor which we haven't discussed yet, is smoking. Now, what is the ways, or have you seen success in getting patients to quit? Jen, is there anybody in your office that you have a particular success rate with a way of getting them to quit smoking? I
think that's a very difficult thing for people to do, is quit smoking. I think it's all very individual, but the first thing to do is not even start thinking about quitting, but at least reducing what they are doing. And then, and I think the most important thing is maybe setting an actual stop date, so that they have, it's not going to be like, oh, I reduced down to half a pack a day over the last 30 years or something like that, but have an actual stop date so that you have a goal in mind, and then work on it from there. But it's very individual. I think nicotine is very addicting, and so it is difficult for the patients to quit, but you have to educate them that it is a huge risk factor for heart disease, for hypertension.
Absolutely, and the thing is that, Paula, have you seen any particular avenues that you've seen patients quit, any things that have worked in the past that you've noticed?
Really, you have to get the whole family involved, because especially if their spouse smokes, it's very difficult. We have to have a clean air house. So you need to educate the whole family, the whole core, and even in our children, secondhand smoke is bad for our children. So when the parents smoke, and with the children around, we need to be cognizant, and we need to really focus on the smoking, the risk. And it seems like younger people. I'm seeing younger people smoking again, where it kind of was taboo, but lately I think we need to get back in and push that. I like some of the commercials that they have on TV, you know, anti-smoking ones that really try to get people's attention.
The thing is that what everyone at home should realize that smoking is an addiction. It's a very, very potent substance that people are, nicotine is very, it's, of course, look at the President of the United States, obviously smoking. It's something that is extremely addicting, and it takes time, help, support, whether it be through medications like Chantix or the patches, the Nicoderm patch, or even acupuncture, hypnosis. I've had patients try all of these avenues, and some of them have worked. So don't give up. The main thing I like to tell everybody at home is if you're trying to quit and you failed one or two of these therapies that we mentioned, don't give up, because the long run, this will be something that will develop into a disease process. There's no doubt that smoking is by far probably the most avoidable risk factor, because it's something you're doing for yourself and you don't need to sustain your life on it, unlike food, like we've just mentioned.
Yeah, we need to focus on that too. If somebody has a bad day, they need not to go off their diet altogether. You know, you're going to have bad days. We need to talk about moderation, how you can do things in moderation, and don't kick yourself if you do have a bad day. You know, just start all over again. It's a new day. It's a new you. Go on from there.
Glass is half full, not half empty, right?
Correct.
So stop, exactly, don't fall off the wagon, pick up the cigarette or pick up that really salty food or sweet food like that donut. The thing is, New Year's resolutions usually fail for a reason, because people try to change their entire life based on one particular day.
Correct.
The main thing is what Paula just mentioned, moderation. Making sure the portion sizing of what you're eating. And I think that's another thing we don't emphasize enough about. When people eat, they don't eat the right amount. Portion sizing is critical, and I think a lot of the diet plans, like Weight Watchers in general, just reduce portion sizing. It's not necessarily that they are reducing all calories, but they're reducing the size that you're eating.
I think it takes into account that we are human, and those white fluffy things are very good to eat, and you know, we're not saying that they have to be eliminated completely, but you're right about Weight Watchers and other diet plans like that. They allow you to eat that sort of thing just in a smaller amount, and we see that in other countries as well. When, you know, people talk about the French people and what have you, they eat all this rich food. Why are they not all horribly obese?
Mediterranean, exactly, the Mediterranean diet.
Really,
they don't have plates this big like we do here.
You're right, and that's why a lot of complaints, people will go to a French restaurant or Mediterranean restaurant and say, why are the portions so small? And they will say this is the average size. Right. And the activity level, if you notice in European countries and in Asian countries too, they have a lot of bicycles. You see a lot of people exercising more and more daily day activity. So I think there's an emphasis here that we really want to say, it's portion sizing, getting out in activity, getting rid of smoking. But let's talk about something else here that it plays in part with heart disease. But tell me about, from the renal standpoint, cholesterol. How much of an emphasis, Jen, in your practice, does cholesterol make a difference in kidney disease?
It's right up there with everything else. You know, we always think about cholesterol with heart disease, with cardiovascular disease, and like I mentioned before, all of our blood vessels are the same throughout the body. They are going to affect every organ the same kind of way. So it is very important to control the cholesterol, because, you know, my main focus is on the kidneys. You can have kidney failure from what we call atherosclerosis. Same thing with the heart, same thing with the brain.
And atherosclerosis is basically building up a plaque inside the artery wall, and that's something we see in the heart, in the kidney artery as well. So obviously cholesterol itself is another one that people don't really feel, but they need to get checked. Now, Paula, have you seen cholesterol levels being changed with diet? Do you think that's something that's, because every patient will say to me, I don't want to be on one of those statin medications. I want to take something in my diet.
Well, statins are very important, and physicians are treating cholesterol levels at a much lower level than they did years ago. But diet does affect it. And there is good fats and there are bad fats. So people need to know which are the good fats and which they cannot eat. And they need some fat in their diet.
Absolutely agree.
So they need to look at labels, look at what they're eating, and stay away from the bad fats.
The trans fats, stay away from the trans fats, and looking at labels. So another thing that we'd like to emphasize today is reading labels. When you go to the store, just because it's more expensive or less expensive doesn't mean it's healthier by any sort of imagination. It's reading the labels for how much sodium, how many calories, how much fat is involved. I think that's something that a lot of people take in consideration. Now, Jen, you mentioned protein before, but it's not necessarily the protein in the diet that's affecting the kidneys, is it correct?
That's correct.
So what would you see when you're saying protein in the urine? That's basically a filter issue in the kidneys.
Correct. So the kidneys filter pretty much every drop of blood that we have, and it should be getting rid of what we call the toxins out into the urine. You've got filters that do this sort of thing. Protein technically is a very large molecule molecule should not come out in the urine. When you're seeing protein in the urine, clearly something's going on with the filters. Something's poking holes in them, and that is clearly damage to your kidneys. When you see protein in the urine, that's a pretty early sign of some sort of vascular damage going on, and that's the time when you should start doing things to either change your eating habits, change your blood pressure, making sure that you're keeping an eye on what exactly is going on with your health.
But you can reverse that. If you see early protein,
yes,
you can get that reversible.
That is reversible.
So that's what
Absolutely.
people at home should understand, that just because we're stating that you may have protein in the urine from a urine analysis that you've done in your doctor's office doesn't mean it's irreversible. So really at that point, when you notice that, is it more blood pressure control is the main concern?
That is the number one thing. Blood pressure control is the biggest thing that we look at first. We always associate it with diabetes. The treatment is not so much controlling the diabetes, it's getting that blood pressure under control. And you can actually get it down enough so that there is no more protein in the urine, and you know that you're actually doing something to improve the vasculature in your body.
Well, you know, Jen, we talked about women and men. Let's talk about minorities a little bit here. Do you see a sense of difference between African Americans and Caucasians?
Absolutely. I think the African American population in general has a little bit of a higher risk for hypertension, for diabetes. They have a higher risk for getting a higher blood pressure, so we try to get that under better control. They respond better to the salt restriction and the diet, everything like that.
And Paul, do you sense that's because more of a socioeconomic issue, or do you sense that they're just not getting the
screening.
education?
I think a lot of people don't have screenings. It's not in their lifestyle to go to the doctor unless they have symptoms. And just like you said, high blood pressure is a silent killer. They don't know they have high blood pressure, so they don't go to the doctor. They aren't recognizing those symptoms. You know, they don't stop at the at Publix and get their blood pressure checked. So I do think that's an educational issue
And
also.
that's very important, I think, because Publix, Walmart, all these stores have the blood pressure machines available in the front of the stores usually, and everyone seems to be using them very comfortably. So I would say that, you know, especially African Americans that are watching this, that's very important to get screened, because the earlier we can catch these processes, we can avoid the issues later on, hopefully avoiding stroke, heart attack, end-stage renal disease. Those are the critical issues. But the thing is that I still think blood pressure, hypertension, it's silent killer like you mentioned, but it's so difficult to convince anyone to take medications. It really is. Now, Jen, when you start these medications, do you start with a combination medication or one medication off the bat?
It depends. If the blood pressure is very, very high, we're looking at 180, 190, 200, they are probably going to need two. And it's hard to convince people that they have to take the medication. When we get to that point where the patient is like, okay, I understand, I need to take something, one of the biggest things we also educate our patients about is don't expect to feel really good after you start taking the medication.
They feel worse a lot of times.
Sometimes they do have
worse,
symptoms,
yes.
And they'll quit taking it because they feel kind of lifeless or, you know, punk after they take it, so they will quit taking their medication.
And it's interesting because, especially according to the males, most of them complain of erectile dysfunction after
Correct.
getting on, especially the beta blocker medications, and they'll say, I'm never taking this again, and I don't care what the blood pressure is. But I usually point out to the same male population that if you develop erectile dysfunction without medications, that is a sign that you're developing cardiovascular disease, because ED is a sign of, or almost a harbinger of later on cardiovascular disease. But I think that at the end of the day, the positives outweigh the negatives of taking medications. So I think emphasizing to these patients that they really should be on something if they're not going to adjust their diet significantly. But I think the argument always is, I'll change my diet, I'll change my diet. And I think that it's important that they actually check some of these websites, either the American Heart Association or the ADA's recommendations for how much sodium they need in their diet, because I think we're taking way too much in as it is.
And I just want to get back to the medication. When they're not feeling well after starting it, eventually they will come back to feeling normal again. Their body's just not used to what a normal blood pressure is. They're used to blood pressure doing this all the time. Once it comes down to normal, the body will acclimate with that and things will come back to normal again, including the erectile dysfunction they may have from some of these medications that we give them.
And it's important for everyone watching to understand that. Yes, you may feel tired, you may feel lethargic, you may feel really just beat up initially after taking these medications, but your body will become attenuated to it. And it's important to keep that emphasis of sticking with the medication and not giving up right away. But again, though, for the medications other than blood pressure and cholesterol, do you feel that aspirin has a part in this play right now?
I think aspirin's one of the best things ever invented.
And I do, and I agree as well. I think a baby aspirin, unless you have contraindications, if you have any other form of cardiovascular disease, is a very good medication, and it doesn't hurt unless, like I said, you have any history of ulcers or bleeding. That would be the only issues where I tell a patient not to be taking it. Well, folks, thank you for all my guests for joining me today. When it comes to heart health, remember, when in doubt, check it out. And at this point in time, I'd like a final message from Paula and Jen. Why don't you give us some final message here?
Well, there are risk factors for heart disease. There's some you can control and some that you can't control. So the ones that you can control, like you say you have high blood pressure, you can't control it. You can control it, whether it be medication, exercise, and diet. So take control of your life. Do the right thing. Healthy mind, healthy body, healthy you.
Jen?
And I have to agree with all of that. And the biggest thing is to be aware of what your body is actually going through. That's probably the number one thing. Be aware of what actually your body is. Even if you're not feeling it, do something. Check and see if your blood pressure is elevated, and then we start from there and try to lead a healthier life.
Excellent. Well, ladies, thank you for being here. And for everyone at home, I'd like you to remember, as always, remember, a positive mind is a positive body. We'll see you next time on The Pulse of Manatee.